Everything's all go then, Nancy? Hey, good afternoon, everybody. Appreciate the opportunity to speak to you this afternoon. My name is Walter Murphy. I'm the managing partner of iBenefitsHR. We are a employee benefit consulting firm. We specialize in helping companies simplify their HR, benefits, and payroll. I'm probably going to take the next 40 minutes or so and go over a presentation I've been doing over the last month called Returning to Work in a Post-COVID-19 Environment. I probably would start off by just letting you guys know that this is very fluid, so that some of the material that I'm going over right now might change in the next couple of weeks or so as things start evolving, as companies start getting back to work and trying to set up a healthy and safe work environment. The presentation, what I'm going to try to do is educate you guys on the best practices for returning to work as the pandemic flattens out, temporary laws are lifted, guidelines and restrictions are spoken about. Back on May 20th, we were just talking about that the state of Connecticut started opening up certain businesses around here. Prior to May 20th, manufacturing, construction, real estate, and hospitals have all remained open. But on May 20th, restaurants, remaining retail companies, offices, I believe yesterday the hair salon started opening up also. And then on June 20th, we're going to have some more businesses opening. I'm not too sure what that list is, but please pay attention to the state of Connecticut. We will also talk about how to migrate risk and establish best practices returning to work, and also to provide appropriate and accurate information and resources for employers regarding the COVID-19 and helping their employees become healthy and safe. So what I'll discuss is making the workplace safe. Right now, there isn't any hard or right ways to do this. So what I've tried to do is pull together all the best practices and a few of my own things underneath the current conditions. And as I said at the beginning, as we start going back to work, I think we're going to start learning more about how this virus interacts and everything, so that some of these things might change down the road. We'll also talk about managing individual health regarding our employees, dealing with a diagnosis, assuming that somebody in our workforce is actually diagnosed with the virus. And at the end, I'll kind of finish up and go over the sick leave policies, and particularly the emergency paid sick leave act that was put in place, I think back in March, by the Families First Coronavirus Response Act. Okay. So right now, as I said, there's no compliance required rules that we have to follow at this point in time. If you looked at the state of Connecticut when they did their Connecticut Reopen, they gave us just some general best practices. So it's up to us to do what's in our best interest for our companies. First and foremost, one thing that is required by the state of Connecticut is masks. So it is an excellent idea to require our employees and our customers to wear masks when they're in the office. Employers are also responsible providing these masks to their employees. The employees can also bring in their own masks or any face coverings if they wanted to. We would also strongly suggest that you write a policy and enforce it as best as possible when it comes to the mask. I do have some sample policies that you guys can utilize if you do want to put a policy in place regarding masks. The CDC currently recommends wearing face coverings in public, and a written policy would help with attendance, just like if you have your sick leave policies, your dress codes, so forth and so on. You want to ensure that you have a supply of masks that are available. You want to communicate your expectations with your employees. I would probably say one of the most important things that when companies do start opening up, if they haven't already done so, is to communicate properly with their employees. The state of Connecticut does suggest that prior to companies opening, they do train their employees. So it's extremely important, if this is going to be successful and we reduce the risk of the spread of the virus, is to communicate properly, since most of us have been working at home at this point in time, and it is a quote unquote new world out there. That being said, also masks do not necessarily replace social distancing. So we also need to continue to do that, okay? Cool. Personal hygiene. The other thing I think, if you guys all remembered at the beginning of this pandemic, is that we were constantly reminded that we needed to wash our hands for at least 20 seconds as much as possible, so we don't spread the virus. We don't want to take our hands, put it to our face, things along those lines. I have a couple of companies that are opening right now. Most of them do have hand sanitizers at each of the employees' desks. And if, unfortunately, if the company cannot provide any hand sanitizer, it is suggested that you do implement some type of hand washing schedule for your employees, whatever that might be, that would fit in to your particular needs. The other thing is some companies are also banning or discouraging employees from shaking each other's hands. I know prior to this pandemic, people were also elbowing each other so that we were not necessarily touching each other's hands at all. Cleaning, whew, this is probably one of the most important things that we can do to our workplace, is to maintain a very clean area, wherever that might be. Providing disinfecting wipes and other cleaning products to our employees so that they can maintain their workplace properly. Also common areas or other machines like computers, things that we might be using on a regular basis, or we might be using with other people. We want to also make sure that we clean that on a regular basis. I had one client that I went to last week talking about assigning schedules, clean as frequently as possible. This one company made it mandatory that their employees clean their workplace at least twice a day, once at 10 o'clock in the morning and 2 o'clock in the afternoon. They've been open since March. They haven't closed down at all, and so far they haven't had any report of the virus at all. The EPA, if you go to their website and you Google COVID-N or COVID list N, it will take you to the EPA website, where they do have a bunch of different products that will kill the SARS-CoV-2 virus. So you can go out there and look at what other chemicals and other things that you can utilize. But it's also, you also have to understand the products that are on that website are for the use of surfaces and should not be consumed by humans at all, okay? Just as an FYI. You also is suggested to mark high-touch surfaces. You know, maybe put a little sticky note on there. Like I said before, printers, maybe in the kitchen area, handles to doors, handles to the refrigerator, things along those lines, so that we can be more conscious of the areas that we will be touching, along with what other people would also be doing at that same time. Okay. We also talked, actually Nancy was talking about this at the beginning. If we could somehow reduce the touch points, I think a lot of companies are moving to motion activated items. These items could be low cost, high tech type of solutions. The cost does vary. Some of these things you can definitely find on Amazon if you wanted to purchase any of these things. But it is strongly suggested that you try to reduce as much as possible any high touch points at all, okay? I think a lot of us, particularly if we go out into grocery shopping or into the retail establishments, we do see this more so than in the office setting. So the open spaces for the public, staggering customer flow, that's particularly when you go out to a grocery store or retail store, you might see that they reduce the number of customers in the store at any one particular time. I know when I go food shopping nowadays, I have to wait outside almost up to a half an hour at times because they're not letting everybody in all the store at once. I believe that the state of Connecticut is just asking companies to limit it to 50% of their capacity. Also what they're doing is marking the floor so that when we go down a particular aisle, it's only in one direction and that people aren't coming toward us, and we're hopefully also maintaining our social distancing. But going backwards to staggering customer flow, if we're also in the workforce, in the workplace, and we have customers that come into our office, we would strongly suggest that, and most of companies have done this already, is not to allow walk-ins. You don't want people to arrive unexpected. You definitely want to do your best and to schedule an appointment with that individual so that you can stagger the time between when one appointment or one individual or customer comes in versus the following, okay? Also to remove furniture to reduce the capacity and create greater distance, and also install blockades. I've been seeing that more at Costco recently. Costco seems to be opening up the aisles a little bit more, particularly at the front of the store, so that when people are exiting the store, everybody's not all on top of one another. Set up touchless pay stations. I think we're also trying to get away from actually cash and not passing cash to to purchase things. So if you have Apple Pay, Google Pay, those types of things, it'll be less likely you would be touching the PIN pad of somebody prior, because even though they might have sanitizers at the front of the store when you leave, I have not seen any of the stores actually clean those things at all. So also want to make sure you do that also. Okay, modifying the office space. Some of this is really up to the building owners. But one thing is to update the air filtration systems. Air pollutants such as any bacteria or germs can build up very quickly indoors. So an effective air system that can flush out the bad air and keep it clean inside is always a good thing for us to do. Also to change our seating arrangements. We definitely want to make sure that the desks are at least 6 feet apart if it's in an open area. If we have an office desk space that's only one occupied or two, you want to make sure that there's enough space between those individuals in there. I've seen companies also put employees into conference rooms. When you do that, you have to make sure that the conference rooms are large enough to accommodate the individuals that you put in there. There are companies that are also starting to use unused office space that they didn't have before. So it's always a good thing to do that. And also the other thing is, if you can't spread the people out, install barriers like plexiglass, I don't know about plywood, but cardboard in open areas so that we're not, if God forbid we do sneeze or cough, we're not passing our germs or the virus over to a fellow employee or a customer at all. Okay. As the state of Connecticut said when they started Connecticut Reopen, it is strongly suggested that if the employees can still work from home, it is strongly suggested. I mean, I personally, from my clients, I don't see too many, even driving here this afternoon, the office spaces or parking lots are all very empty now. I don't think we're going back to work as quickly, or at least the offices aren't opening as quickly as other retail or other companies have done. From a manufacturing standpoint, those companies have staggered their shifts from a production standpoint to allow to reduce the number of employees in a factory setting or in an office so that we can, again, minimize the virus spreading among our employees. Some companies have gone to 2 or 3 shifts where they had just had 1 shift prior. From an office perspective, I haven't seen this at all yet, but I think offices, if you do want your employees to go into the office, I do have one client that made it mandatory that as of yesterday, June 1st, their employees were required to come into the office. They felt that it was extremely important for them and their business to have their employees in the office. So what they try to do is to schedule their employees, again, based upon the rules of the state of Connecticut, or suggested. They allowed only 50% of the capacity of their employees into the office. But what they were doing is they were rotating. They would have one group come in on Mondays, Wednesdays, and Fridays, another group coming in on Tuesdays and Thursdays, and then flipping that the following week. So if you can do something like that, that would also be helpful. Cool. Modifying meetings. If there's one thing that I think many of us are doing right now is attending way too many Zoom meetings. I know me personally, that's all I've been doing. Positive thing is that it's very easy and very convenient to attend a virtual meeting. I think the other thing is that a lot of people are kind of getting burnt out on this concept at this point in time. I have attended way more meetings now than I had prior to the middle of March. So many companies, if not all, have been modifying their meetings, and everything is basically virtual at this point in time. Modifying if you really needed to have an in-person meeting, you definitely want to hold it in a large area, large conference room that's well ventilated. Prior to the meeting, you want to make sure that you set up the chairs to make sure they're at least 6 feet apart ahead of time, so that people, when they do come to the meeting, they go directly to those chairs and they're not interacting close, social distancing with each other. You also want to reduce the number of chairs that are actually in that conference room or in that room. Again, we don't want our employees to run into each other or things like that. And if you can, as Nancy's doing to this meeting, recording them so that, you can use it for other team members or other employees that could not make the meeting in person. Okay. So before I get on to managing your health, does anybody have any specific questions on that section at all?
I can unmute everybody for a moment just in case.
No questions? Good. Okay, so what we'll do is we're talking about managing individual health. Before we get in there, one of the things that employers are allowed to do now is before an employee enters the office area or the building, they're allowed to ask their employees questions regarding their health in regard to COVID-19 only. Okay, this has to be specific to COVID-19. You can ask your employees about any symptoms that they might be experiencing, and you may also give them a temperature test if possible. This is all under the Equal Employment Opportunities Commission, which is allowable. That being said, if you do have any mandatory tests or screenings, it has to be job related and it has to be consistent with business necessity. That being said, it also has to be in compliance. Any screenings that you conduct has to be on a non-discrimination basis. So for example, this may mean that you test all your employees before they enter the facility or the work location. Another thing is extremely important is the test results have to be treated as confidential medical records, okay? That's in compliance with the Americans with Disabilities Act. And you have to communicate the related screening to your employees prior, so including any details of what the screening will entail, expectation of the employees, and assurance that the screening will be completed in compliance with the laws that govern, okay? Having the employees self-assess before they come in. I think one of the things that you should suggest doing is on the day the employee is supposed to come to work, they can self-assess themselves to see if, first and foremost, if they have any symptoms at all. This is just a short list of some of the symptoms. It might or might not change, but right now, cough, shortness of breath, difficulty breathing, fever, chills, muscle pain, sore throat, any loss of taste or smell. Feel free to have the employee stay home if they experience any of these symptoms. You definitely do not want them to come into work if they are experiencing any of their symptoms. Also, if they're experiencing a fever, again, based upon the CDC, it's 100.4 degrees. So if the employee has that temperature or higher, it is not recommended they come into the workplace at all. Okay. So if you do have your employees take their temperature prior to coming into the office or the facility, you want to give them some guidelines. You want them to wait at least 30 minutes after they eat, drink, or they exercise before taking their temperature. If they are taking any type of medication as a fever reducer, like Tylenol or aspirin, anything like that, they need to wait at least 4 hours after they take the medication. And again, if they have a temperature, you want the employees to stay at home. I've seen a couple of companies that will take the employee's temperature before they come into the office. You might see this more in the retail as a customer. If you do go into retail that will take a temperature, you want to ensure the person who's taking the temperature does have sufficient personal protective equipment. is no definition of what would be appropriate. I think first and foremost, definitely masks will definitely be on that list. Maybe some gloves. You also want the employees who, if you do decide to take the employee's temperature or your customer's temperature, to feel 100% comfortable and safe when they're doing that. So if they need or want any additional type of PPE, like a face shield or safety gloves, or maybe an apron or a gown or something, just to ensure that they feel 100% safe, you should also do your best to accommodate them. Again, keep it confidential. During this process, if you are testing employees or customers as they're walking into your facility, you do not want anybody else to know if they had a fever or they do not have a fever. So again, confidentiality is extremely important if you're going to do this. Okay. What about if you ask about any type of symptoms? Again, any questions you ask your employees have to be regarding COVID-19. You cannot ask them any open-ended questions. How do you feel today? Or anything like that. It has to be specific to COVID-19. How would you respond to your employees if they did have any symptoms? You want to, again, have the employees notify you as soon as possible if they have any symptoms. You want to have that employee evaluated as quickly as possible. You might want to send them to see their physician and maybe take a test. And then also, if they do have any symptoms or a temperature, you also might want to consider isolating that employee. Again, we were trying to minimize the spread of the virus, okay? The other thing that we have to contend with is anxious employees. Right now, there are a lot of employees or companies that are not necessarily opening right now because there are a large percentage of their population that is very nervous about coming back to work. So if you do open your doors and your employees come back, you want to make sure that you reduce their anxiety. You want to talk to them about keeping the workplace safe. Again, you want to train them prior so they have a relatively high comfort level about coming in to the workplace, and that you've done the best you possibly can to reduce the risk or exposure to the virus. You want to, as I said, these things change, so you want to ensure that you continually to adapt and are open to any suggestions any of your employees might have. You might not necessarily implement them, but you might want to listen to them. You want to allow them to wear any extra PPEs that they feel comfortable with. We definitely, even though this is physical, I think eventually we'll start talking about the mental aspects of how this virus is also affecting us. So we want to reduce our employees' anxieties. We provide them with links to the latest guidance so they can follow along with themselves. I am going to provide a couple of links at the end from the state of Connecticut, the CDC, and also OSHA, if you want to give that to your employees. And you want to remind them that they don't have any, if they have any special circumstances, fear is not a sufficient reason not to return to work. You've probably been hearing about, and we'll discuss it on the leave at the sick leave at the end. There are employees that are on furlough or been laid off and everything, and some of them are, I think, if I remember correctly, 68% of the employees that are out on unemployment right now are actually receiving 100% or more of their prior COVID-19 income because of the federal government throwing an additional $600 a week in benefits, which I believe goes toward the end of July 31st. There is talk that that's going to end, and the government or the Congress is considering giving employees bonuses if they do return to work. But we do need to deal with employees that are very anxious about getting back to work. Okay. That being said, we also want to do our best to provide reasonable accommodations for our employees, particularly underneath the Americans with Disability Act. You want to make sure that you bring back your employees that aren't in the high risk category. You also want to be conscious of the employees that might have a family member that they live with that's in a high risk category. So we want to be very conscious of that. So you want to put a list of your employees you want to bring back. We'll discuss this at the end, providing an unpaid leave of absence for them and allowing them, again, if you can allow your employees to work from home, that's probably the best option that's possible. Again, allowing and providing additional PPE stuff, material, and providing additional hygiene and cleaning breaks. Okay. So before I move on to the section that dealing with an employee that was diagnosed with COVID, does anybody have any questions at all?
Hi, Walter. This is Amanda. Have you gotten into any reviews of self-certification apps for the temperature checks and health checks?
Not yet. Not I.
Okay. Yeah. I was just wondering if there's anything out there that's better than not. We're having difficulty trying to figure out with multi buildings how to get those done across our full organization. So,
Amanda, I'm going to make this is Nancy. I'm going to make a quick suggestion, only because I personally know the company. They're out of Dallas, Texas, but it's called Wello. And they have an app and a system that you could probably do with multiple buildings and so on. So it's just like it sounds, Wello.
perfect. Thank you.
Any other questions? No? Okay. Now let's deal with a situation where we have an employee that's diagnosed with COVID-19. At the end of this presentation, I'm going to provide you guys with various checklists that I can make available to you. But prior to opening, you need to be prepared with the possibility that somebody will be diagnosed with COVID-19. So you want to have a specific plan in place prior so that you're not scrambling at the last possible minute when somebody is diagnosed. You want to be able to, first and foremost, respond to the employee directly. You want to talk to them about self-isolating and isolating them. You also have to have a plan in place to notify fellow employees, customers, vendors, and any guests that might have been in the work location or had any interaction with that individual. And also disinfecting the area that the person works in, whatever that might be, an office area or a facility or anything like that, okay? Other employees should be notified. Again, I cannot strongly emphasize, you cannot give out any names or anything like that. You have to keep it confidential. Depending upon the size of the company, it's not your responsibility to police everybody, but there is a possibility, you know, that the word might get out about who that individual is. So you want to try to minimize anxiety and having other employees, you know, get very nervous that they were interacting with that employee, okay? As I mentioned, This one slide definitely changed. When can the employee return to work? Sick employees should definitely go see their healthcare provider as soon as possible. If the employee is not being tested for COVID-19, you need to isolate them. And the criteria there for self-isolation is 72 hours, or have them return to work 72 hours after no fever without an assistance from reducing fever-reducing medications. Other symptoms, if they did have them, have improved, and at least 10 days have passed since the initial symptoms started. Prior, I think in the beginning of May, that was 7 days, so they increased it to 10 days just recently. Now, if we have an employee that's diagnosed with COVID-19 and they actually get tested and they tested positive, the criteria for them to return to work is that they currently have no high fever at all. They're not taking any type of medication for that fever. All the other symptoms have improved. And that they have taken 2 tests prior to coming back to work that are both negative and that are within 24 hours of each other. Okay? So depending upon if the employee's tested or not tested for COVID-19, all depends on when they can return to work, okay? Do exposed employees need to quarantine? These are employees that have had some interaction with that employee, and that all depends upon the situation, how close they were. The CDC does define having a prolonged period of time with a individual as 15 minutes without any social distancing and mask. That being said, if the person's in close contact, it might have been only close contact with that person for a minute or so, less than 15 minutes, and they coughed or sneezed in their direction, well, then they, definitely should definitely self-isolate. If they're standing together on a factory line with no mask, probably a very good idea to quarantine them. But if they're sitting in a large area, cube, and the person's asymptomatic, it's probably not necessary. We will also be talking about employees that are asymptomatic in a couple more slides down the road, okay? Because that is extremely important. Do you need to disinfect or close the work site? That all depends, to be honest with you. I know that from the recommendations that the CDC recommends that you do not clean the area for at least 24 hours. If you can't wait 24 hours and clean sooner than that. My understanding is they would rather you wait to have an individual go into that area for 24 hours. Hopefully the possibility of the virus dying would be greatly reduced. So the longer time we can do to go to disinfect and clean that area, the better. But if we're unable to wait that 24 hours, then we're going to have to go in there sooner, okay? That being said, if we do send anybody into the area where the employee worked and they need to be disinfected, according to the state of Connecticut, they definitely need to wear gloves, masks, face shield, and I'm not 100% sure, but it might be a gown also, but I believe those are the things, but I have to look that up just to clarify. Okay. There is CDC guidance for disinfecting the area used by an employee that's been diagnosed with COVID-19. You can close off the area that's used by that sick person. Again, if you can get some ventilation, that would be extremely helpful. Opening any doors or windows to help increase the air circulation in the area. Again, waiting 24 hours to clean or disinfect. If not, is wait as long as possible. Clean and disinfect all areas and items used by that person who is sick. This is a tricky one. If most likely you probably won't be vacuuming, but if you do have a service that comes in that does vacuum, you definitely want to make sure they adhere to the CDC guidance. You might want to go to the CDC website because it is extensive about how to properly vacuum a contaminated area. Once the area has been appropriately disinfected, you can then open up for use. Workers without any close contact with that person can return to work immediately after disinfection. And if the person hasn't been in the office for at least 7 days, you can do some additional cleaning, and disinfecting might not necessarily be necessary at all, okay? Ooh, I'm sorry, I'm looking at the time. Okay, anybody have any questions at all? I'm gonna try to wrap this up in 5 minutes.
Walter, I actually have a quick question. What happens if you're in an office building, like the chamber is, we're in an office building, does a business have to notify other businesses within that building of a positive test for of one of their employees? Because, you know, the common spaces, common elevators, all of that kind of stuff?
That is a great question, Nancy. I have not come across any language or anything that says that that another business or even the building owner would need to notify other companies in the building. That's a great question.
I'll do some digging now.
That's an excellent question. Now I have to look that up myself now. Any other questions? I know that we're pressed for time, so I'll do my best, Nancy. So I apologize if I go too quickly, but I know that we have a hard thing at 2 o'clock. So the best way to keep our workplace safe is by keeping our sick employees at home and make sure if they do come into the office and they are sick, to send them home as quickly as possible. You also want to make sure that you have a sick leave policy and it is enforced just like an attendance policy is. I'm going to kind of jump forward because I want to go over the Emergency Paid Sick Leave Act that was passed back in March. Here in Connecticut, this is an expansion of FMLA. This affects all employers with less than 500 employees, okay? This paid sick leave is specifically for COVID-19. It is paid by the United States government. And as I said, it was passed in March in 2020. Employers are required by law to put up the statues in the location or to provide it to their employees digitally that they know that they are covered by this sick leave. For small employers, 50 and under, it does adhere to them, but they could file for an exemption. There is certain things, criteria they need to meet for a small employer to be exempt from this statute. And I'll be able to provide that at the end. But for most part, companies with less than 500 employees have to provide it to their employees. It's available to all employees, no matter how long they've been with the company. The employer can take the cost by providing leave at the top of their payroll tax bill, so the government does pay for it. The emergency paid sick leave must be offered in addition to any other sick PTO or sick leave offered. Employers cannot be required to have their employees use the benefits prior to the act. And by I think it's December 31st, if I remember correctly, that this law sunsets, so we don't have to worry about it unless they extend it. Okay. So again, this has to be related to COVID-19 and the employee is unable to work or telework, okay? So there are 5 particular ways an employee can take this leave. If the employee is subject to a federal, state, or local quarantine or isolation order, if the employee has been advised by a healthcare provider to self-quarantine, to seek medical diagnosis for a COVID-19, to care for an individual who qualifies either underneath number 1 or number 2, or to care for a child because the child cannot go to daycare or to school. So those are the things that the employees can use that for. From a duration and pay perspective, full-time employees for 40 or more hours can get up to 80 hours over 2 weeks. Part-time employees who work less than 40 hours per week can get the number of hours worked on average over a 2-week period. So how do you calculate what the employees are entitled to? So for 1, 2, and 3, assuming you're a full-time employee, the employee can receive up to 100% of their regular pay to no more than $511 per day or $5,110, okay? When caring for others, employees may receive 2/3 of their regular pay for up to $200 per day or $2,000 total, and that's for uses 4 and 5. Excuse me. It's not mandatory that the employee take the leave all at once. It could be over a certain amount of time, but it cannot exceed more than 80 hours. Okay. Documentation. Just like for the employers that have 50 or more employees, there is an FMLA form that the employee completes. We do have a form. If you do have an employee that wants to take the leave, so the information that you need is that the employee's name, the date and dates they've requested the leave, a statement of the reason the employee is requesting the leave, and a statement that the employee is unable to work, including teleworking, for any particular reason. That being said, you can notice that a doctor's note is not required, and you're not allowed to ask the employee for a doctor's note, okay? They just need to complete that form, and you just need to file it so that you can get your tax credit from them. Okay, at this point in time, I'm done, but I'm just gonna go real quickly. Again, I can pass out this presentation, but the state of Connecticut does have some links for you to utilize. They are attached to this. I don't know if you guys can see it that well, to be honest with you, but there are 3 of them that you can click on. There's also information from the CDC and OSHA and a couple of other things that you can look at. Again, this is a fluid situation, so you definitely want to make sure that you pay attention to any changes, because changes will happen. So you can stay up to date on that. There's information besides this PowerPoint presentation. I do have a return to work checklist for best practices, for posting and policies, health and safety. We also have some information on creating a return to work action plan. As I said before, communication is key to employees. We do have a template to welcome the employees back to work. We also have a PowerPoint presentation. If you wanted to, do a meeting or a Zoom meeting for your employees, kind of like what we just did. There are various checklists on cleaning, on workplace preparation, again, on how to deal with a positive COVID-19, and also how to communicate properly to your employees, okay? Also deciding how to, or who to return from a furlough or to a layoff. But last but not least, we put together 10 different e-learning classes for both managers and for employees, so that you can, again, communicate to the employees in this post-COVID-19 environment. And there's no cost to that if you guys want it. They can run from 20 minutes to 60 minutes. It's for employees and for managers. Okay? And that's all I have, Nancy.
So this is great stuff. Thank you.